Hi, I'm Dr. Michael Cookson, and I'm the chairman and professor of urology at the University of Oklahoma, and I'm also the chief surgical officer at the Stevenson Cancer Center. And we're joined here today by a special guest, Mr. Jeff Davis, and Jeff's going to talk to us about his journey with prostate cancer.
Well, hello, Dr. Cookson. Thanks for the opportunity to be here. I was diagnosed at the Mayo Clinic with prostate cancer, which was a surprise to me because I had been paying attention to my PSA score for 8 years. I'd been doing annual blood work, and I missed one, and then it was in normal range, and then 15 months later it had gone from 2.5, which was in range, to 11 point, I believe it was 11.6 as PSA. I asked the Mayo, well, who would you recommend that I talk to as a surgeon in Oklahoma? My doctor at the time at Mayo said, well, I work with Dr. Cookson in Vanderbilt, and if you can get Dr. Cookson to be your surgeon, there's none better. Sadly, 90 days after surgery, I had a recurrence, which is, as you know, is very rare for that sudden a recurrence. And so that started me on the pathway of 39 sessions of radiation and prescribed. Now, I actually stopped treatment yesterday at 21 months of androgen deprivation therapy, and so we're just taking it 90 days at a time at this point.
Well, Jeff, you certainly haven't had it easy. That's, you know, of course, what we hope is that when we find cancers, we find them early and then we're able to treat them and then cure them, and that is still our goal for you. Talk about the impact that your cancer diagnosis has had on your family.
We take it all in stride. I mean, my business career, I didn't experience high highs or low lows. And so we take it in stride. You know, it's impacted my wife and I. I would say we're closer than we've ever been.
Yeah. Jeff, you want to talk a little bit about what it is about prostate cancer that you want men to know?
Well, you have to take control. Procrastination is not your friend. Wishing it away is not your friend. Take control of your health, whether it's prostate cancer or any other type of men's health issue. I joke sometimes that men fear the finger. The finger is not necessarily part of the diagnosis. PSA test, blood test, is very, very simple and pain-free, and it can save your life.
It does really begin with a blood test. Almost all of us can be determined whether or not we're appropriate for screening simply based on a blood test. The level of that blood test has to be interpreted based on your age, based on other factors. I want to talk a little bit with Jeff about his gift. He made a significant contribution to improving the lives of men with prostate cancer through a gift which includes awareness, some community outreach, and research. Could you talk to us a little bit about how that came to be, Jeff?
Well, we were looking for opportunities to make an impact. I would say prostate cancer awareness and treatment and research is not at the top of the list of most people when they think of giving. We just felt we could make a more direct impact because fewer dollars are flowing through this very, very important initiative. And we need more. We need perhaps individuals that have experienced prostate cancer themselves, that have recovered, perhaps going through this. We need you to help us and Dr. Cookson raise money here in Oklahoma. It's a tremendous problem, a tremendous issue, and so we're hopeful that our gift will kind of jumpstart or provide seed capital, if you will, to raising more dollars for prostate cancer awareness. I mean, at the end of the day, that's what we're doing here, is we're saving lives, and I firmly believe that's the outcome. If we don't save lives, I think we will, we're certainly going to make quality of life better.
What Jeff said is right. At the individual levels where we really need to make a difference, and getting one person to come forward and get screened. Maybe it's their wife's, advice to go. Maybe they're having other issues, but getting that awareness to get that test and then to follow up on that test if they get that test is our best chance. But even in those men in whom we don't discover the cancer as early as we would like, There are multiple treatment options available that can extend the life, the quality of life, and the length of the life. And so that's also a goal of our Cancer Center, is to really help those who are more advanced and guide them into those therapies that will help them the most. And there are many out there. So there's a whole lot of good things happening in prostate cancer right now, in addition to the front end, our initiatives towards screening. Jeff, do you have any final thoughts about this as we kind of wrap up this session?
You asked earlier about how it has impacted my life. I mean, it's a drag getting radiation and being on this treatment. It certainly beats the alternative. And the fact of the matter is, I've continued to stay very, very active. Some people laugh at this. We bought an RV earlier this year. We've seen the country. We're enjoying it. I've played a lot of golf. We travel. Not to say that this is not serious. It is. But as Dr. Cookson said, there's reason to have optimism for the future. But you have to start getting the test, get diagnosed, get on it, fight it, and you'll be okay.
I want to really thank Jeff for helping us, one, raise awareness about prostate cancer, two, trying to improve the quality of the life of men in Oklahoma through a variety of means, including prostate cancer detection, and then three, for his personal generosity in allowing us not just some of his resources, but some of his time to try and help reduce deaths from prostate cancer. So Jeff, thank you very much for that.
Thank you.